Do you know much about Indian Health Services? Do you have any clients that are on a reservation? Do you have tribal clients? Let's talk about Indian Health Services. It provides healthcare for over 2.6 million Americans, Native Americans, and Alaskan Natives, which is over healthcare in 37 states and over 574 recognized tribes. Now, this is what you need to know as an agent, is that Indian Health Services is not credible coverage for Medicare Part B, but it is for Part D, the same way the VA is for Part B, not for Part D. That's the way the law was written. I know it doesn't make sense. Just memorize it. Now, you need to know that because for many people, they are interested in a Medicare Advantage program. Indian Health Services is not insurance. If you live on a reservation, you can get your care in those clinics for free. But if you want to go outside the clinics, Indian Healthcare is not insurance. It doesn't allow you to go out. Now, different tribes do different things. We just said there's over almost 600 different tribes, and they all do different things. Everybody thinks now that the tribes are all rich. Well, they're not all rich. Most of them are not rich. And so some of them want to encourage their members to also sign up for Medicare Part B so they can get a Medicare Advantage plan. That helps the tribe expand their healthcare dollars, extend their healthcare dollars, what they're getting from Indian Healthcare, and they can double dip a little bit here with the feds through Medicare. So if you don't sign up for Medicare Part B when you're first eligible, you get the late penalty. Now, some tribes will pay the late penalty, but in general, you have to tell your client you have the same window as everybody else. Indian Health Services is not credible coverage. Another thing that you need to know is that IRMA, the surcharge for high earners, if your client is a Native American, they might have a lot of their different sources of income not count towards IRMA, because that could also dissuade people from signing up for Part B, such as the Alaska, the state dividend from the oil companies, casino money, hunting, fishing, and other natural resources income. So there's quite a few things that would not count. So that is important if you do have clients that are Native Americans. Like I said, it's so different all across the board. Every tribe does it differently. The one thing I want you to take away is that Indian Health Services is not insurance. It works in the tribes, typically in the reservation. And if your clients want the flexibility to go out, some tribes will pay for them to go out. Most of them will not. That's where Medicare would come in handy, so they would have the opportunity, the flexibility to go off reservation. If you have more questions, ask us in the comments below. If you learned something today, please hit the subscribe button. Thanks for watching.